that affects millions of people worldwide. It is characterized by high blood glucose levels due to the body's inability to produce or effectively use insulin. This article aims to provide a detailed overview of diabetes, its types, causes, symptoms, complications, management, and prevention strategies. Types of diabetes. Type 1 diabetes. This form occurs when the immune system attacks insulin-producing beta cells in the pancreas. It is often diagnosed in children and young adults. Hence, it was previously known as juvenile diabetes. Individuals with type 1 diabetes require lifelong insulin therapy. Type 2 diabetes. The most common form of diabetes. Type 2 develops when the body becomes resistant to insulin or when the pancreas cannot produce enough insulin. It is often associated with obesity and physical inactivity and is usually diagnosed in adults, though it is increasingly seen in children and adolescents. Gestational diabetes. This type occurs during pregnancy when the body cannot produce enough insulin to meet the extra needs of the mother and the developing fetus. It usually resolves after childbirth, but increases the risk of developing type 2 diabetes later in life. Other specific types. There are other less common forms of diabetes, including those resulting from genetic syndromes, diseases of the pancreas, or drug-induced diabetes. Causes and risk factors. The exact causes of diabetes vary by type. Type 1 diabetes. The cause is largely autoimmune, with genetic factors playing a role. Environmental triggers such as viral infections may also contribute. Type 2 diabetes. This type has a stronger connection with lifestyle factors. Key risk factors include obesity, sedentary lifestyle, poor diet, high in refined carbohydrates and sugars, family history of diabetes. Age. Risk increases with age. Ethnicity. Certain groups are at higher risk, such as African Americans, Hispanics, and Native Americans. Gestational diabetes. Risk factors include obesity, a history of gestational diabetes in previous pregnancies, and a family history of diabetes. Symptoms of diabetes. Common symptoms of diabetes include frequent urination, increased thirst and hunger, fatigue, blurred vision, slow healing of cuts and wounds. Unexplained weight loss, more common in type 1. It is essential to recognize that some individuals, particularly those with type 2 diabetes, may not experience symptoms initially, making regular screening crucial. Complications of diabetes. Diabetes can lead to a range of serious health complications, including cardiovascular disease. People with diabetes are at a higher risk for heart disease and stroke due to increased blood sugar levels, leading to damage in blood vessels. Neuropathy.